Hello and welcome to another Facebook Live broadcast with MedStar Health. My name is Sarah Ridenauer, and today I'm joined by MedStar Health neurovascular surgeons, Dr. Andrew Stemmer, Dr. Paul Singh, and Dr. Samir Sur. Today we're going to be talking about the brain's blood vessels, specifically cerebrovascular disease and its diagnosis and treatment. So if you've ever wanted to better understand what happens in your brain when it's affected by a stroke, aneurysm, or chronic disease, then stick around, share this broadcast with your friends, give us a like to let us know you're watching, and please ask your questions for our experts in the comments below. Well, first of all, thank you guys for joining today. We really appreciate you all taking the time out of your day to be here and join this discussion. Before we get started with the questions, could you each tell the viewers a little bit about yourself and your specialty? I'll start with you, Dr. Singh.
Hi guys, thank you all for joining today's broadcast on Facebook Live. It's always great to talk about this because it's near and dear to all our hearts on this call today. And hopefully we can dive in a little later to everybody's questions. So I am Paul Singh. I am the Director of Neurovascular Surgery up here at MedStar Franklin Square Medical Center, which is a thrombectomy capable center in the greater Baltimore area. And hopefully we can talk a little more about that later today. I'll defer now to my colleagues.
Thank you. Dr. Stemmer?
Yeah, hi. Thank you. Happy to be here. My name is Andy Stemmer. I am a stroke neurologist and a neurointerventionist. I'm the director of the comprehensive stroke program here at MedStar Georgetown University Hospital. And I also oversee the MedStar-wide telestroke program, which has outreaches to all of the MedStar hospitals.
Great, thank you. And Dr. Sur?
Thank you, guys. Lovely to be here and join my colleagues. My name is Dr. Samir Sur. I am a neurosurgeon specializing in cerebrovascular and neuroendovascular surgery. I'm primarily based up at Franklin Square with Dr. Singh, and I'm the director of cerebrovascular and skull-based surgery here.
Awesome. Well, thank you guys again for joining us. So first question, in layman's terms, what does cerebrovascular disease mean, and what is neurovascular surgery? Dr. Singh, did you want to take this one?
Sure, and I think this kind of encompasses all of us could add to this on here. Cerebrovascular disease entails any pathology or any problems that you would have either in the brain or spinal cord that has to do with the blood vessels. And so over time, our blood vessels take a turn. They're not what we're born with. So when we're in our teens or 20s, we have normal blood vessels. And as you get older, they have incurrent disease inside and they get more narrow, or they might form abnormalities within them. And it's our job to help diagnose problems with those and also treat those in time. Treatments are very broad. They can be medical management. They can be good medications that decrease our risk factors. They can be simple lifestyle changes, but they can also entail treatments that are a little more invasive. Some of those are catheter-based approaches that all of us here do. And others are surgical approaches, which Dr. Sur does. And he'll talk more about that, I'm sure, at length. So that's a good broad overview of what we do.
Great, thank you. My next question is, can one of you tell us a little bit more about the neurovascular intervention program at MedStar Health? It looks like it was started in our DC hospitals, but it has now expanded to MedStar Franklin Square.
Andy, do you want to maybe take that since you're down at the...
Yeah, sure. I think, yes. So there's, as Paul was saying, there's open surgery and then there's medication, which are both, play prominent roles. But then the other option for treatment in some cases are sort of minimally invasive approaches or endovascular, which is the inside of the blood vessel. And so briefly, that's where we enter usually an artery, and it can be either in the wrist or it can be in the hip area. And we take a small catheter or a small tube up into the blood vessels of the neck or the brain to do whatever we need to do to fix blood vessels. The two programs that were most established historically were at MedStar Washington Hospital Center and MedStar Georgetown University Hospital, both of which are comprehensive stroke centers. That's been for somewhere around the last 20 years. And then more recently, we've expanded with a program up at Franklin Square, which is just going great. And I think we all have a lot of enthusiasm and think there's a really great opportunity ahead.
Great, that's awesome. Thank you. So Dr. Stemmer, what does it mean to be a comprehensive stroke center?
Yeah, so there's, let me think about how to answer this in a way that makes sense. There are different classifications or levels of stroke centers. So the American Heart and the American Stroke Association have joined together to really push forward the treatment of care for patients with stroke. And this is over the last several decades to improve our metrics, to improve our treatment capabilities, to make sure that we're tracking all the things that we do and all the things that improve patient care. And so there's primary stroke centers, which have the ability to give certain medications in an IV in stroke patients. And then there's thrombectomy capable centers that can do medications plus all of the procedures and minimally invasive and open surgical open surgeries. And then the comprehensive center is the highest level, which means that you can do all of those. You also incorporate a certain amount of research and teaching, and then you also have backup capabilities to handle more than one stroke at a time, should that happen. And there's certainly, so that's a very sort of broad strokes overview, but that's where we stand.
Okay, thank you. And then Dr. Singh, Dr. Stemmer kind of covered this a little bit, but my next question was, what does it mean to be a thrombectomy capable stroke center? Did he cover everything, or do you have anything to add to that?
No, I mean, he really did. He was pretty thorough with that answer. I would just add that, it's exactly right that Franklin Square is a newer site, and the established sites for the past couple of decades have been Hospital Center in Georgetown in the MedStar system. But cerebrovascular disease is rampant. And, we always throw out this number and we say 800,000 people in the United States have some stroke, whether it's ischemic or hemorrhagic, every year. And this metropolitan area is no different. So there's a lot of high blood pressure, high cholesterol, smoking, diabetes, which makes this something that's a huge need for the tri-state area for patients that are over here. And it is such a need that between the three major centers that Dr. Stemmer described, there's actually 10 neuroendovascular physicians that do these minimally invasive procedures to treat strokes, to rescue strokes, to treat hemorrhages in the brain. And to say that we have 10 of us that actually do this subspecialty amongst our group is really saying something about how MedStar Health has expanded neurovascular care. 10 people in any group in any subspecialty is a lot, but for this one, it's really, really telling. And it's a commitment that we have to our patient population in this area. Thrombectomy capable, just as Dr. Stemmer said, says that we're able to provide these procedures that are for patients that are having urgent strokes in the greater Baltimore area with more rapidity. And in addition to that, we offer that to our other MedStar sites as far as an access site. So MedStar Montgomery, MedStar Union, Harbor, St. Mary's, those hospitals that otherwise would be a little further away to reach our big centers at Hospital Center in Georgetown now have access to this site too for patient care. So I think it's a great addition to the MedStar Health network as far as neurointervention goes.
So then that kind of goes into my next question, which I was going to ask you, Dr. Sur. What is the benefit of a system approach for patients?
That's a great question. And not only is it a question of access to care, these things can be emergent procedures. We nowadays have the capability to intervene in really important time-sensitive matters to help when the brain doesn't have enough oxygen. But also it means that our hospitals are well equipped to handle the complexities of these patients after their initial procedure. We're very fortunate, as Dr. Singh mentioned as well, to have a number of providers who are honestly in constant communication and take a collaborative approach to dealing with these often complex patients. And from a hospital standpoint and a system standpoint, it makes MedStar well equipped to handle the other issues that can arise when patients are dealing with these types of diseases.
Great, thank you. My next question, what makes cerebrovascular disease so scary for a patient? Like what's potentially at stake for someone?
That's another really good question. Cerebrovascular disease can be especially concerning for a couple of important reasons. One is that sometimes we discover disease processes incidentally. So a patient can have minimal symptoms, but we can discover something like an aneurysm or a problem with the blood vessel that has a risk of causing a really big problem, like bleeding in and around the brain or blockage of a major vessel, which could lead to a stroke. So that can be a really important nuance of determining what the specific risk is and how we can treat that with the most efficient and safest way to get the best possible outcome for patients.
And then you mentioned this a little bit, but what causes this disease?
Yeah, it can be a number of things and I think Dr. Singh and Dr. Stemmer mentioned this, but sometimes we're just born with certain variants in our blood vessels, which predispose us to having a certain risk of either having not enough blood flow or bleeding in and around the brain. And sometimes the process of aging or other risk factors, lifestyle things like our diet, our level of exercise, and other disease processes that affect blood vessels in the body can have an effect on whether stenosis or narrowing of the blood vessels develop and things like that.
Great, thank you. So I'm going to take a second pause and tell our viewers, if you're just now joining us, thanks for tuning in. I'm joined today by MedStar Health neurovascular surgeons, Dr. Andrew Stemmer, Dr. Paul Singh, and Dr. Samir Sur. Today, we're talking about the brain's blood vessels, specifically cerebrovascular disease and its diagnosis and treatment. So if you wanted to better understand what happens in your brain when it's affected by a stroke, aneurysm, or chronic disease, then stick around, share this broadcast with your friends, give us a like to let us know you're watching, and please leave your questions for our experts in the comments below. My next question is, what can be done at home to minimize risk? And then with that, we have a question from one of our viewers that I think kind of ties in with this. Dottie asked, do the brain meds and memory meds that are being advertised help at all with this? Dr. Singh, did you want to take that one? Oh, you're on mute.
Sure, I'll start with the former question. Maybe I'll defer the second one to.
Okay.
The first one is that what can be done at home? And first of all, stroke is a very scary disease. One thing about it is sometimes it happens all of a sudden. We don't have any warning about it. And even if you have some of the traditional risk factors, you have the symptoms develop like this. If you have an ischemic stroke that is a non-bleeding stroke where you have a blood clot go to the brain, sometimes there's no warning. Same thing with the bleeding stroke. You can have an aneurysm in the brain that ruptures and you have a severe headache, but there might be no warning signs in the days or weeks beforehand. Unless you have vigilant monitoring from your primary care provider who can sometimes screen for these things. So what can we do? We can take care of ourselves, and it's easier said than done these days, especially with the pandemic and our limited access to some of the gyms and stuff that we used to have, but we're getting back to that now. But taking care of yourself. So healthy lifestyle, good eating, making sure that if you have high blood pressure, you're eating that appropriate diet and you're seeing your primary doctor, you're taking your medications. If you're smoking, easier said than done, but stop. High cholesterol, right diet, start getting activity in, take your medications. So all these things can really help us minimize the risk. But what I always say is that anybody, even if you minimize the risks, anybody is still at risk for stroke. And you have to be cognizant of what the signs and symptoms are so that if you have them, you can urgently go to an ED or call 911 to get the care you need. That's very, very time dependent.
Great, thank you. And then Dr. Stemmer, do you want to take the second half?
Yeah, so I think the question was in regards to medications for memory and sort of cognition. Was that sort of the gist of the question?
Yes, yeah.
You know, I want to be a little bit careful about what I say. I'm not sure what the medication is specifically referring to, and I'm not a memory disorders expert per se, but I would just say a few things. First, you know, we do have a memory disorders clinic here at Georgetown, and we do have a number of ongoing trials and studies that are going on looking at these medications because there is no shortage of opportunities to sort of chip away at this disease and people with memory issues and cognitive issues. So there are ongoing studies. I just don't know what the specific medication is. Having said that, I don't think there's been a major breakthrough in something that reverses, memory loss that has happened. There are certain medications that are out on the market now that they sort of delay the progression of memory issues, but I'm not sure that they sort of reverse them in the sense that I sort of sensed from the question.
Okay, thank you for explaining that, and thank you for sending in your question. So this is something we've also touched on a couple times. What are the symptoms to watch for, and when should patients start being monitored or seek treatment? Dr. Sur, do you want to take this one?
Yes, there's a lot of good information out there in terms of recognizing the signs and symptoms of acute stroke. We typically worry about things like acute onset of weakness or numbness, often in half of the body. Sometimes that can be noticing a facial droop or weakness holding up an arm or difficulty walking. Even acute changes in vision can be a sign that something urgent is going on with the blood vessels in the brain. And then there are subtler symptoms which can happen that can be risk factors or warning signs when a stroke may be coming or there may be cerebrovascular disease that needs to be addressed. One of those things is where there's vision loss transiently in the eye. Sometimes patients refer to it as it seems like a shade is coming down over the eye. That's sort of a classic sign that it's perhaps time to get a checkup and see exactly what's going on with the blood vessels. And then other things like headache, severe headaches are often signs that there could be bleeding or a warning leak in the brain. And so headaches shouldn't be ignored when they're out of proportion with normal migraines or their sudden onset.
Thank you. Thanks for explaining that. And then if a patient ends up in an ambulance, I think this is an interesting question. Can they or their caregiver, whoever, is with them at the time, can they request where they would like to receive care, or they just initially, taken somewhere and then afterwards they can request further care elsewhere?
It's a good question. It's a hard question in a sense to answer. Generally speaking, each state has its own laws on how EMS and paramedics will route patients towards hospitals.
Okay.
But in general, if someone is being seen for a stroke, then they go to the nearest stroke capable center.
Okay.
And so this goes back to what we were talking about with comprehensive centers and thrombectomy capable centers. And so what the state of Maryland has done with their EMS and DC has done with their fire and EMS is when the paramedics identify what they think is a stroke, particularly if they think it's a large stroke or a large vessel stroke, they reroute patients to the nearest thrombectomy or comprehensive stroke center, to a hospital that can fully deal with the problems of a possible stroke. So generally in these circumstances, patients and family members do not have the opportunity to decide where they're going. When paramedics picks them up, they're usually they have protocols that tell them they have to get to the nearest hospital that can fully deal with the stroke.
Okay, that's good to know. Thank you. And how do you diagnose the various conditions? Dr. Singh, did you want to take this one?
Sure, happy to do so. It echoes what Dr. Sur said earlier with the diagnosis in the field as far as what are the symptoms are. And that ties into our diagnosis over here. Those symptoms that he mentioned as far as weakness of the face, the arm, or the leg, or speech issues or problems with vision, those are the symptoms that we want our patients to know about before they have a stroke. Because if they have these symptoms, they need to get into the ED from 911, an ambulance ideally, to get there so they can get these time-sensitive treatments. When they get to us, we do urgent imaging of the brain, and we want to see if whoever is there with their symptoms, if they've had a brain bleed or if they have the non-bleeding variety of stroke. The non-bleeding variety of stroke is actually the more common variety. It's about 85% of strokes that we see. And if they have that, then they go through a series of testing to see if they have blockages in the brain or the neck that need to be urgently treated. And so we have a very protocolized system of care with all our MedStar hospitals of how all of these stroke patients are evaluated to see if they need these urgent treatments. And even if they don't need the urgent treatments, to see what the next steps are in preventing strokes in the future.
Great, thank you. We have another question from one of our viewers. Are strokes hereditary, or some people more susceptible based on genetics to having them than others?
That's a great question. Stroke is a broad term that can encompass both ischemic stroke, meaning there's not enough blood flow to the brain, usually because of narrowing or a blockage of a blood vessel, or hemorrhagic stroke, which refers to bleeding in or around the brain. There are some genetic factors that can make people more likely to have both types of strokes. But in general, the large majority of the strokes that we tend to see that involve urgent treatment or emergent treatment due to blockage of large blood vessels happen to anybody. And certainly, as we talked about, other risk factors like heart disease, diabetes, these things that can have some genetic factors as well can contribute to patient stroke risk. But there are not usually specific genetic conditions that are passed on from family member to family member that specifically increase the chance of having a stroke. On the other hand, cerebral aneurysms occasionally do run in families, and we tend to be cognizant of that, and even in some cases recommend screening of family members if they've had direct family members, multiple, that have had cerebral aneurysms or bleeding from them.
That's good to know. Thank you. And thank you for your question. My next question is also for you, Dr. Sur. What are the various treatment options?
Again, a great question and a bit of a tough one to answer specifically, because when we talk about cerebrovascular disease, we're really talking about a large group of disease processes, and each of these disease processes can have multiple different treatment strategies. I think, as my colleagues mentioned earlier, in general, we can sort of divide our approach from a surgical standpoint into two categories. One is using catheters and special devices inside the blood vessels, where we can treat diseases including narrowing of blood vessels or embolizing aneurysms or brain tumors, where you can use special devices to limit the blood flow in certain cases or expand it. And then there's open surgical techniques like microsurgery for some aneurysms that are not amenable to endovascular surgery, or stenosis of the arteries that go into the brain. They can be open surgically. And there are also some tumors that have a strong vascular component where we use both of these techniques to try and get the best possible outcome for our patients.
Great, thank you. So what support is available to patients during recovery? How long does recovery take? Can we talk a little bit about, the patient journey through this whole journey?
I'll take a stab at that. That's a good question. These are all really, really good questions. Just to back up for a second, I think that we have a lot of resources and tools that are at the hospitals we have with, CAT scans and MRIs and operating rooms and interventional suites. But really the public awareness and in the community level of what a stroke is and what the signs and symptoms are and what to do when you have a stroke is really so critical. That initial recognition can oftentimes make all the difference. And sometimes people recognize it themselves, but oftentimes it's their loved ones, families, friends, caregivers that recognize the symptoms. Mm-hmm. So really important topics. The patient journey, to your question more specifically, again, strokes come at our spectrum. Some are small, some are large, some have minor symptoms, some are really debilitating. But oftentimes our patients will have rehabilitation afterwards. So that can be things like physical therapy, occupational therapy, speech therapy. Some of these things are done with the therapist, and some of them are done at home by yourself or with loved ones. We're very fortunate in DC that we have the National Rehabilitation Hospital as an acute rehab facility. It's attached to the Washington Hospital Center, and patients from Georgetown go there as well, which is really just an excellent sort of world-class rehabilitation facility that specializes in things like head trauma and also neurologic illnesses or diseases like stroke. And they have a really broad spectrum of models and tools and therapists to help get people back to the highest possible level. But it doesn't just end from inpatient rehab. It often continues as an outpatient at home as well. And then these are oftentimes processes that go on for months and years. So it's not that you're ever necessarily done healing, but you're just getting better slowly over time.
Right. Thank you for explaining that. We talked about, I think we mentioned one of these earlier, but are there any exciting innovations, research, or technology on the horizon?
Yeah, innovation in the neurospace is cutting edge, and that's the easiest way to put it. It's one of the most thriving and the most accelerated areas of technology innovation in all of medicine. Things are happening at a rapid pace, especially with cerebrovascular disease, and that means there's new medications on the horizon for breaking up clots. and many of our sites are already trying out these medications with success. This is internationally, but MedStar Health is participating in a lot of that. In addition to that, there's new devices that allow us to get to clots that we couldn't get to even 2 or 3 years ago. There are catheters that we're getting into the brain are softer, they're longer. They take a lot of practice to actually get good at these things, and there's a lot of designs that have to be researched before they're used in patients. And so it takes years of science, years of research, years of collaboration with many partners to develop these. And it's happening very rapidly in this space. So when it comes to ischemic stroke, that's one piece of the pie that we talk about with capturing these clots and removing them from the body. This is also happening for aneurysm. It's happening for other hemorrhages in the brain. So I think there's going to be a large influx of patients that have access to even more technologies than they did just 2 or 3 years ago in the coming decade.
That's great to hear. It's awesome, to hear how far technology can go in the medical space with, just a short amount of time. So that's great to hear. So my last question for you guys is how we like to end all of our broadcasts. What is the message you all would like for our viewers to take away after joining us today? I'll start with you, Dr. Sur.
Thank you. In general, we have an amazing program here that's growing. And, as Dr. Singh and Dr. Samir mentioned, the tools at our disposal to treat these often complex diseases are expanding right before our eyes. We have the ability to use new catheters and new devices. And we're very fortunate to be able to really impact people's lives in really major ways when we're able to get to them and treat them urgently and effectively. So, I think the takeaway is that we have a great program here. We're very fortunate to be well positioned to serve this community, and we're a growing program. So we look forward to helping where we can and to growing this program even further.
Great, thank you. Dr. Stemmer?
Yeah, I think the thing that I would take away, I think from a patient perspective, is that we really have a team of people that cross different sort of specialties. So radiology and neurosurgery and neurology all work together as part of a team. I have appointments in different departments, as do both of my colleagues. And so we're always collaborating and working on these and talking about these to provide the best, the best treatment. I think that's what strikes me most about our system.
Great, thank you. And Dr. Singh, I think I did this to you last time too. I had you go last. Sorry about that.
Well, first of all, thank you for having us all on today. It's nice to actually share this space with such established colleagues, with Dr. Stemmer and Dr. Sur in this conversation. My big thing ties in exactly what my colleagues have mentioned. I don't take it lightly that MedStar Health has 10 neurointerventionalists, and it's one of the most cutting edge programs in the entire country when it comes to delivering this type of care for our patients. And that's what we're here for. We're here to deliver this care to more and more patients than we could ever do before. And realizing on the patient side that if there's a question about cerebrovascular care, that you have a partner in your physicians that are here to deliver that type of care for you, whether it's at Georgetown in DC or Hospital Center in DC, or up here in the Baltimore, Maryland area at Franklin Square.
Awesome. Well, those were all great points to wrap up our broadcast. Thank you guys for joining us today, and thank you to our viewers for tuning in. If you would like to schedule an appointment with one of our experts in the Baltimore area, please call 443-777-7999. And in the Washington, D.C. area, please call 202-877-5026. We'll be posting those numbers in the comments as well. Thank you all again for tuning in, and we'll see you next time.